Let's get cracking. We start this hour with statistics to make your heart sink today, with shocking figures suggesting some patients are waiting up to 40 hours for an ambulance as the NHS faces delays higher than at any point last winter. It follows the announcement this week that ambulance workers in 3 unions have voted to strike over pay and concerns about staffing levels. The Royal College of Nursing, as we covered a lot yesterday, is also staging 2 strikes this month. This afternoon, Downing Street has urged public sector unions to call off what they are saying are unnecessary industrial action and return to the negotiating table. But it sparks debate as to whether or not NHS staff should be demanding more money when the service that they're offering, potentially, isn't fit for purpose. Now, I don't say that lightly because of the tremendous work that NHS staff do, but I just wanted to take you through some of the numbers that, well, you might not see anywhere else. So let's drill down into those figures now. There's a clear trend appearing, and it's not easy to look at, but I will take you through it. So, the target response time for an ambulance, specifically for the most serious cases, is just 18 minutes. So you get sick or one of your loved ones falls down the stairs or something, you call an ambulance, they're supposed to be there in about 18 minutes. For those of you watching on TV, you can see this graph from NHS England. Now, back in September 2020, that's during the height of the COVID pandemic, really, isn't it? You'd have to wait just over that 18-minute target for an ambulance. So there we are, middle of a pandemic, supposedly a national health crisis, 18-minute wait. Bingo, Bobby's your uncle. Fast forward to October this year, and the response time is at an all-time high, at more than an hour. If you live in more rural areas like Cornwall, for example, it's even worse. The average waiting time there is more than 2 hours. Now, it's not plain sailing once the ambulance actually arrives either. You've been waiting at the bottom of your stairs with a shattered hip, thinking, when is this thing going to get here? And, you know, a few hours later, the ambulance rocks up. Great, I'm on my way to hospital. But hang on, because nearly 1 in 3 patients arriving at hospitals in England by ambulance last week waited at least 30 minutes to be handed over to A&E teams. More than 11,000 patients, so that's 15% of the total, waited over an hour. Again, TV viewers can see the rising trend is pretty clear there. We've even coloured it in bright red for you in case you are, well, hard of sight. In October, more than 150,000 people had to wait up to 12 hours for a bed when they arrived at hospital. There is lots to unpack here, and it comes, of course, amid a backdrop of strikes. We did the nurses yesterday, and we no doubt will continue to do them again. Ambulance workers, and this includes paramedics, emergency care assistants and call handlers, so the whole shebang, really, are striking. They are going to strike. It's about 10,000 of them because they think the 4% pay rise that they've reportedly been offered is not enough. They say it's a real terms pay cut. And if you look at this, it's going to take place before Christmas. One would imagine, if they've got any sense, it will coincide possibly with nurses' strikes, which makes it very difficult for me to countenance what they say about patient care. And it's this line that we've been hearing, isn't it, from both the nurses and from paramedics and from people in the medical profession. I'm sick and tired, frankly, of a lot of doctors coming on this show and telling me, well, come on now, we support these strikes because patient care won't be affected. Well, how, if you've not got any paramedics, emergency care assistants, call handlers or some nurses? I mean, clearly now, we can't just be taken for fools. Patient care is going to be affected. But your view, do you think the strikes are justified? Are they really angels?